If you're home from the hospital following a total hip replacement surgery and wondering what exercises to do, you're in the right place. Today, I'm going to show you 7 safe and effective exercises that you can do the first few days following your hip replacement surgery. Hi, my name is Cathy and I'm a physical therapist, but be sure to follow your surgeon's specific precautions following your surgery. Now, the precautions that you have will depend on whether you've had the anterior approach or the posterior approach. The things you want to avoid if you've had the anterior approach are excessive hip extension, especially when it's combined with external rotation. If you've had a posterior approach, you'll want to avoid bending your hip more than 90 degrees, internally rotating your hip, and crossing midline. These precautions are in place to reduce your risk of dislocating your new hip. Now, the goals of these exercises are to prevent complications following your hip surgery. We want to keep the circulation going so that we reduce our risk of having a blood clot or a DVT, and we want to begin gentle muscle activation. For these exercises, you'll want to do them gently and stop if you feel any pain. For all of the exercises I'm showing you today, besides the ankle pumps, you'll want to do sets of 10 and you'll want to do them 3 times throughout the day to help keep the circulation going. So the first exercise you're going to do is ankle pumps. Now, of course, you'll be lying down in your bed, but I'm just right here to show you a few of these. What you're going to do is push your feet down as if you're stepping on a gas pedal and lift them both up in the air. You're going to go nice and slow to help improve your circulation. And you're going to want to do 10 of these about every hour to help keep the blood flowing, to help prevent the vein thrombosis or a blood clot. The next exercise is a glute set. And what that is you're just going to squeeze the buttock muscles together, making sure that you don't hold your breath and then release. Now, you'll do 10 of these and you'll do them several times throughout the day. You're just squeezing, making sure that you're not holding your breath and releasing. The next exercise you'll do is a quad set. So suppose I've had my right hip replaced, it's this one right here. I'm going to squeeze the muscle in the top of my leg, holding for a few seconds, making sure I maintain normal breathing, and then release. I'm going to squeeze the muscle in the top of my leg, bringing my kneecap up, and then release. You'll hold it just a few seconds and relax down. And I don't know if you can see it, but my thigh muscle here is tensing up, and that's exactly what you want. So the next exercise you'll do is a heel slide. You'll just slide your heel toward your buttock and then slide it back down. Now, if you've had the posterior approach to a hip replacement surgery, you're going to want to make sure that you keep your hip well below 90 degrees so that you don't risk a dislocation. And again, you'll do 10 of these. Now, the next exercise is called a short arc quad or just a knee extension exercise over a bolster. You might need to have somebody help you get a little something under your leg. And then what you'll do is just tighten the muscles in the front of your thigh, holding it for a few seconds and letting it down with good control. Now, while you're doing these, again, you'd want to make sure you maintain normal breathing and slowly lower it back down. And the next exercise we're going to do is supine hip abduction. I'm going to keep my toes pointed straight up and slide my leg to the side of the bed and back to the middle. I want to be careful that I don't rotate my hips in or out, so I'm going to keep my toe pointing straight up, and we're going to go back and forth 10 times. So the last exercise I'm going to show you today is a knee extension exercise. I'm going to extend my knee and slowly let it return to the start position. You'll want to be sure to work your surgical leg when you're doing this, but if you'd like to go ahead and work your other leg, that's perfectly fine. These 7 exercises are a great way to start moving safely after your hip replacement surgery. If you've had a total hip replacement in the last week and you're ready to move forward with your recovery, you are in the right place. Today, I'm going to show you 7 new exercises that you can do post-op weeks 1 through 4. Be sure to follow your surgeon's specific hip precautions. Now, the goals during this phase of recovery are to begin strengthening and improving range of motion and improving your gait quality. During this phase of recovery, you're most likely still using a walker, and at the end, you may be transitioning to a cane if your gait is starting to normalize. As we begin the exercises for phase 2, you can continue with the exercises from phase 1. We'll just be adding in more strengthening range of motion exercises. Now, the first exercise we're going to do is a modified bridge. We need to modify this to avoid excessive hip extension, which is one of the precautions that you have if you've had the anterior approach. So what I'm going to do is bring my feet a little bit closer to my buttocks. I'm going to put a towel roll in between my legs to make sure that I don't rotate my hip. And I'm just going to lift up, but not all the way like you would with a normal bridge. I just want to come high enough that I clear my buttocks from the table and then come back down. Now, as I'm doing these, I'm going to make sure that I maintain normal breathing because I don't want to hold my breath. And I want to make sure that I keep a little bit of a flexion in my body. My body's not completely straight as I'm doing these. Now you'll start with about 10 of these and slowly increase to 2 sets of 10 as you get stronger. Now the next exercise I'm going to do is hip adduction. Now you want to have a towel roll or a large pillow or a ball between your legs because you want to make sure that you don't cross midline with these. So I'm putting the pillow between my knees and I'm giving my legs a squeeze together and I'm making sure that I maintain normal breathing at all times and relax. So you'll want to hold these between 3 and 5 seconds, making sure your hips don't pass midline. The next exercise I'm going to do is a straight leg raise. I'm going to bend the opposite leg, tighten the muscles on the front of my thigh, and lift my leg up to be about even with the other leg, and then slowly lower it back down with control. Now, this one is going to be quite difficult, especially if you've had the anterior approach. So if you can't do 10 to start, just start with maybe 5 or 6 and build up as you get stronger. If you find that the straight leg raises are too difficult for you, just keep on with your short arc quads from phase 1. Now, the next exercise we're going to do is single limb marching. What we're going to do is just lift up the surgical leg, making sure that we keep it below 90 degrees so that we get a little bit of strength in the front of the hip. Again, you'll do about 10 of these. The reason we don't want to lift up the non-surgical leg, because that would mean all of our weight is on the surgical side, and we're probably not quite ready for that just yet. So when you're doing these, you want to make sure that you're only lifting between 45 and 60 degrees because you want to make sure that you're not getting to that 90 degrees. From the side, it would look something like this. Now, if you're doing these at home, you'll want to be either using a sturdy chair, a walker, or maybe standing by the kitchen sink. Now, the next exercise you're going to do is hip abduction. You're only going to move the surgical leg, and you're going to want to make sure that you're keeping your toes pointing forward because you don't want to externally rotate or internally rotate your hip with this. Now, the leg you're standing on, you can have a slight bend, and you're just kicking right out to the side for 10 repetitions. And if you can, you'll do 2 sets of 10. If you can only do 1 set of 10 to start, that's okay. Just gradually increase as you're able. Now, the next exercise is hip flexion. I'm just going to be kicking forward, not too high, and we're just doing the surgical leg. We're going to do 10 repetitions of this as well. From the side, it'll look something like this. We're going to keep our back straight. We're going to keep our core muscles engaged by drawing our belly button into the spine, and we're just kicking forward to a comfortable position. So the next exercise you'll do is some simple weight shifts. You'll stand with your feet flat on the ground, about shoulder width apart, and what I'm going to do is just gently shift my weight over to my surgical leg. I'm not going too far though. I just want to feel the weight going directly from my hip down to my foot, and then I'm going to shift back to the middle. This is going to be important later on when I'm learning to walk without an assisted device. I'll be used to having some weight on that surgical limb. So we're just shifting over and back to the middle. As you're doing these exercises, remember there's no reason to rush. Just go at your own pace. And if you'd like, you can continue doing phase one exercises as you incorporate these new exercises into your program. Now, these exercises are going to help you start to walk more normally and regain your strength. If you had a total hip replacement surgery about a month ago and you're ready to move into the next phase of recovery, these exercises are for you. Today, I'm going to show you 6 new exercises that you can do during post-op weeks 5 through 8. Hi, I'm Cathy. I'm a physical therapist, but before you do any exercises, make sure that you're following your surgeon's precautions. So one of the main goals during this phase of recovery is to normalize your gait so that you can begin walking without an assistive device. Now, whether or not you should be walking without an assistive device will depend upon your surgeon's recommendations. But also you want to make sure that you can walk without a limp, that each leg can weight bear equally, and that you no longer need an assistive device for your balance. Now, during this phase of recovery, you can continue on with the exercises from phase 2, but now we're going to add in a few new exercises. And the first exercise we're going to add is a mini squat. So what you're going to do is stand in front of a counter or a sturdy chair or even use your walker, and you're just going to bend your knees, keeping your back straight, and then return to the start position. You'll want to keep your feet about hip distance apart as you bend your knees, keeping your back straight, and then return to the start position with a good amount of control. You'll start with 10 of these, and then you'll want to build up to 2 to 3 sets as you're able. Now, in phase 2 of recovery, we did do marching, but we just did single limb. In this phase, we're ready to move on to marching, alternating left and right. Now, if you have a little bit of trouble with this, you might want to start in front of a chair to get you unweighted a little bit more, or maybe by your kitchen counter. And this is just going to relieve some of the weight. You can put a little bit of the weight through your arms. You could also do this using your walker. Now, the next exercise is going to be hip abduction. We're going to stand on one leg and then move the other leg out to the side, making sure that we keep our toes pointed forward. That's important because we don't want excessive internal or external rotation. Now, we did these in phase 2 as well, but we only did the surgical leg. Now we'll be shifting the weight onto the surgical leg and lifting up the opposite leg to get some strength in there. Next is going to be hip flexion. We're going to lift up our leg and bring it back down with a good amount of control. Again, we're going to do 10 on each side. Now, as you're doing these exercises, you want to make sure that you're not holding your breath. And if it's a little bit difficult for you, you can put your walker in front of you just to unweight a little bit. Next, we're going to work on our balance progressions. First, we're going to try standing on one leg. Now, if you're not feeling confident with standing on one leg, you can just put the toe of the opposite foot behind you as you try to balance. Now, I've got my chair here to make sure that I maintain my safety at all times. So the next exercise I'm going to do is stepping side to side using the chair for a little bit of balance. I'm just going to step to the right and then back to the left, and I'll repeat this about 10 times. This is going to help with the weight shift and hopefully over time improve my walking. Another thing that you can do for your endurance during this phase of recovery is a recumbent bike. But you'll want to make sure as you're bringing your leg around on this that you're not going past 90 degrees of hip flexion. Using a recumbent stationary bike will help you with your endurance. So that's it for this phase. So be sure to stay consistent, listen to your body, and always follow the instructions of your surgeon and your therapist. If you found this video helpful, you might also like this video here.